It's so unusual. We're all in the room.
Yeah, right?
Up on the screen. Yeah.
Maybe I'll go ahead and get started and then we can.
I'll let you.
I think we have quorum, so we go ahead. So I will go ahead and start the meeting. Are we recording and everything digitally? Okay, great. So as we've always kind of begun with our affirmation to prep us for the work that we have, I want to thank everyone for their time, effort, and participation in our work for us today. I want to recognize that this is very difficult and important work and say that I appreciate and value the perspectives and professionalism that everyone brings here today. Thank you. So we'll go ahead and get started with roll call.
Sarah Merrick.
Here.
Scott Strickland.
Here.
Margaret Weddle.
Here.
Lauren Bowling.
Here.
Welcome, Lauren. Sarah Duckwell.
Present.
Ryan Hearn.
Present.
Stacy Llewellyn.
Present.
Patrick Priest. Hopefully you'll be here any minute. Ken Schlesinger. And Andrew Stoll. Andrew. Okay.
Great. And so I see first up public comment. Before we do that, I just wanted to introduce our new official now, correct?
Yes.
Labor member Lauren Bowling of the Ironworkers. You want to say hi or have any?
Hi, all. Lauren Bowling. I'm with the Ironworkers and happy to be part of MLAC.
Nice. Awesome.
Welcome.
Well, welcome. So next I see on the agenda public comment.
Yes, Dr. Vern Sabo, I believe, is virtually with us today.
Yes.
Good morning.
Good morning. Trying to get my idea to work. I keep it on and off. Good morning, Dr. Vern Sabo. I'm sorry, what was that?
Yeah.
So,
Proceed, yeah.
representing the Oregon Chiropractic Association. And again, we're going to be bringing back our proposed legislation returning full attending physician status to chiropractic physicians in a workers' comp system. You have the documents I just sent. Again, it's just a 2024 study, again, showing positive outcomes as per cost, as well as patient outcomes for individuals with spine-related musculoskeletal complaints. And you've had the 80-some pages of peer review articles. Is that my slide you're holding up?
Yes.
So I wanted to, in terms of on a personal note, you have the data. The evidence is overwhelming that save money will provide better outcomes for patients with those spine-related injuries. No, I love what I do every day as a chiropractor. This is my 43rd year in practice. And a little history on me. I served on the Governor Kitzhofer appointed me to his health systems transformation team in 2010. Our team created coordinated care organizations. And the next year I served on the Health Evidence Review Commission. He appointed me to that for 10 years. And in 2016, we rolled out new policy that Oregon Health Plan patients could get chiropractic care based on high quality evidence of what we do working, namely spinal manipulation. Now it's been 8 years. And so I am on panel with Samaritan IHN CCO. I love working with the providers within Samaritan's system. We have some 250 providers over the last 8 years in my database from 10 communities that send me Oregon Health Plan people. Is it just me or is there a lot of background noise? I'm hearing a lot of noise. Are you hearing that background static?
Nope. we're not hearing anything on our end.
Okay, so, and so I've been treating these folks, and it's very heartwarming. They're so thankful for the care. I never really understood completely what the working poor meant. And now I do, and it's been very heartwarming. And as I've said prior, as these folks came in, I take a proper history in my private office. I try to get all the medical records so I can go to school on that particular patient's case. And they always get my absolute best. And the providers know that. They see it reflected in my chart notes. When these stories would come through, they continue to. In their history, they had a work-related injury. They still have the problem. And they were describing how they were treated. They were sent to an occupational medical clinic, many times not told that they can go to the healthcare provider of their choice. They described the care, and many times it's substandard. The occupational medical provider at some point determines that they're at maximum medical improvement. What I see on my end is then their case is sent to by SAFE Corporation or another insurer to one of the IME vendors, independent medical examiner vendors, examines them, generates a report and an opinion, which is then sent back to the OCMED provider for concurrence. And many of the time, in my opinion, it's there's a lot of noise. It's not in the best objective measure. The 2004 DCBS IME study revealed that 53%. Somebody needs to put their phone on mute because there's a lot of noise.
We're not hearing anything on this end.
Okay.
I know sometimes if you turn down your volume on your computer, then you can speak and won't hear the feedback and other issues.
Okay, so I want to give a real world example, and then I'll end my testimony. It's very disturbing to me. I had a little nurse, a veteran. She came to me under TRICARE. I treated her. She did quite well. I hadn't seen her for a while, and she came in for care. She was distraught. She was frustrated, and she was going to pay cash. And so in the history taken, I said, "What's going on?" She goes, "Well, I have the horrible neck pain, a horrible headache." And I said, "Well, when did this start?" She says, "Well, about 14, 15 weeks ago." I said, "Well, you knucklehead, why didn't you get right in?" And then she tells me this story. She's a ER nurse over at the Good Samaritan in Corvallis, and her and a coworker were walking in a crosswalk when another Samaritan employee driving a van wasn't paying attention and hit her in the crosswalk. Now it was like he tried to stop, but didn't stop in time type of thing. She goes flying. This little veteran is like 4 feet 10 inches tall. She's rendered unconscious, so she comes to work. I understand it, that morning on a gurney into her job place in the ER. CT scan finds no internal injuries, thank goodness, no fractures. And the human resource person tells her that she's got two choices, either the Samaritan Occupational Medical Clinic in Albany or by the hospital, or the one out at Waverly Drive, Corvallis Clinic, Occupational Clinic, which is who she decides to go to. She sees Dr. Chris Swan, who I know well. And according to this worker, who I believe, this little veteran, for 14 weeks, Dr. Swan does not lay a hand on her. He does not examine her. He does, of course, no hands-on treatment, no referral out for any type of therapies, and continues to write her releases from care. Her neck and headaches were so severe that she, after 14 weeks, came into me out of frustration. I did functional x-rays. It revealed significant ligament tears in her upper cervical spine, atlas axis, the alar ligaments, which will cause those kind of headaches. And I began to treat her and make a long story short, within 3 or 4 visits, her headache was 90% resolved. And this has been 14 weeks. So my care is limited. So she was then, she was removed from my care. Last week, I was up at the Capitol for legislative days, talking to legislators about this issue. I had just met with Chief of Staff at Senator Patterson's office, and when she calls me on the phone crying and describes how she is now being treated, her claims being worked, and how she's being treated, and that it's basically going to be closed, and it's the same scenario I see over and over again, and it really is inappropriate. And part and parcel to that is we're gone. We can't advocate for the patients through the life of the claim for those like her who have legitimate injuries. I mean, for goodness sake, she was struck by a van. Anyway, I'll complete my testimony there. Thank you.
Thank you much. Do we have anybody else online or in person? I believe there's one other hand raised online. Oh, in person. Okay, so next I see review of the minutes for April 4th and May 2nd. So starting with April 4th, I would entertain a motion.
Can I do a slate?
Sure.
I move both.
You'd recommend both?
I do. Approval.
Do we have a second?
Second.
Okay, any discussion? Hearing none. All those in favor signify by saying aye.
Aye.
All those opposed? And any abstaining? So minutes for both of those dates are approved. Next, I see department updates.
See, we have the board, workers' comp board, Lauren.
Can you hear me all right, everybody? Yes, okay. Thank you. Good morning, everyone, co-chairs and members. Thank you so much for having me today. I just have a quick update on some rulemaking action at the board that's taken place recently. So at its May public meeting, the board voted to propose several rule amendments that are consistent with recommendations it received from 2 recent advisory committees. So the first proposed rule amendment concerns OAR 438-005-0055, which requires that specific language regarding a worker's appeal rights be included in the denial. The amendment is not really designed to be a substantive change to any of the workers' appeal rights. The proposed amendment is designed to simplify and improve the readability of the appeal language. So it's mostly formatting and wording changes. The other proposed amendments concern the board's rules that set caps on the attorney fees that can be awarded out of the proceeds of a disputed claim settlement or a claim disposition agreement. So the current rules provide that in the absence of extraordinary circumstances justifying a greater fee, such fees are limited to 25% of the first $50,000 in settlement proceeds and 10% of any additional proceeds. So the proposed amendments remove the 10% cap for proceeds over $50,000 and provide that an attorney fee of up to 25% of the total settlement amount is awardable. The board is currently seeking public comment on the proposed amendments. A rulemaking hearing will also be held by telephone conference at 10 a.m. on June 28th. So instructions for accessing the hearing as well as all of the rulemaking materials are available on the board's website. Are there any questions?
Not seeing any.
And I don't have any updates for WCD. I mean, there are things going on, but I don't have anything to share.
All righty. Thank you. So the next I see up is the 2025 WCD legislative update with Matt West.
Morning, co-chairs, members of the committee. Matt West, I'm the interim administrator here at the Workers' Compensation Division. Last month, at the last MLAC meeting, I gave an overview of the legislative concepts that we're putting forward. So the update right now is that we've started meetings with our stakeholders. Terry's reached out and scheduled a bunch of meetings. We just wanted to put out there that if you haven't received an invite and would like one, to please reach out to Terry. Anyone on the committee, but also anyone listening right now. I'm happy to meet and discuss, kind of give an overview and then address any questions or concerns you have. So that's the update, short and sweet. Great. All right. Stay here.
Yeah.
Okay.
Please.
I got the look from Terry.
So I see, were there any questions on that update? I figured not, pretty quick. Next on the agenda, I see SB 533 MCO report on come-along providers for 2023.
Great, that's me again. So Senate Bill 533 from 2013 requires the director to provide MLAC a report about denials and terminations of come-along providers. For those that maybe aren't familiar, so when a worker is enrolled in a managed care organization, if certain conditions are met, they can get what's called a come-along provision, meaning they can bring their provider, continue care with their provider. So this bill requires us to just report each year any denials. So for calendar year 2023, there were 4 MCOs operating in Oregon: Kaiser, Caremark, Majoris, and Providence. And then just to note, Caremark ceased operations December 1st of 2023. So there are currently 3 MCOs now. So each MCO provided the report to the division as required. And in 2023, there were 2 providers that were denied or terminated. So that you should have a copy of the letter, one in the Portland area and one in the Salem letter. So 2 workers had that denied. One was a termination, so failure to comply with MCO terms and conditions after being granted come-along privileges. And the other was denial. It's previously terminated from serving as an attending physician within the last 2 years. So those are the 2 denials from 2023. Happy to answer any questions.
Can I ask a clarification
Yes.
question, Matt? Was the failure to comply the PCP's failure to comply
That is a good question.
or the patient's failure to comply?
We have our MCO specialist in the room. Is that typically the provider's failure to comply?
Yes.
Yeah.
And do we have much trend data? I know I've been on MLAC for a little while, but does it seem that it's sort of averaging 2 or 3 or very few denials a year, or?
In my experience, it's very few.
Last few years, yeah, it's only a couple.
Yeah, so it seems to be the current trend.
Okay.
Any information on Caremark and what happened?
I don't have any information, just that they ceased operating, got out of the business, I guess.
Any other questions?
Any indication on how many providers are approved in 2023 and so on? Or are we just keeping data on denials?
I know they're required to report denials. I don't know that they're required to report
Or come-along
approvals to us.
approvals, yeah. Just curious.
Yeah, I don't have
Yeah,
that.
that's okay.
It's a good question.
I think the kind of tag along to
Yeah.
that. Is there any report on kind of coverage of areas and availability of services? I'm thinking especially rural areas or other outside.
Yeah, I'm sure we could pull some information on that and provide it.
Isn't it on the MCO website, on our WCD website? Is that correct?
I'm not sure.
I'm sorry, I didn't hear that.
Any information on like coverage, geographic areas and coverage of MCOs, is that on our website?
Coverage by cover level providers?
Just in general?
Yeah, we have data concerning provider type for each MCO and the difference in the states.
We'll pull together some
Great,
information
yeah.
and provide it to the committee.
Really nice to know.
Yeah, thank you. Other questions? Not seeing any. Thank you.
Thank you.
Very much.
Thank you.
Work plan update is what I see next. And I see we have 3 different topics, starting with NIOSH firefighter
Yes.
cancer presumption report.
Yes. So I have been looking into this NIOSH firefighter cancer presumption report that was listed in House Bill 4113 from 2022. And I reached out to NIOSH because I was trying to figure out where the report was. And that was a bit of a dead end. I did hear back from Carl Koenig, who is with the Oregon State Firefighters Council, I believe. And he is the lobbyist for the state firefighters. And he is reaching out with to Washington, D.C. to check on this registry. The short story is there is no report right now. So, but we believe that there's one coming. There is a firefighter cancer registry. There is, they're collecting data, but on the work plan, it said that we were going to review this report in the spring of 2024. And so I talked to the co-chairs. I'm like, I'm not quite sure what to do. I've hit a dead end. And in reviewing the bill information, it says that we will review the report when we get it. We just don't know when that will be. So I did want to give an update on that because, like I said, it was on our work plan. We did say that we would do that.
So Terry, is it at least flagged that we want this report as soon as it comes out and they're going to send it to you? I mean, we get that things get delayed and obviously, and that was a tentative whenever it is released.
Well, when I talked to NIOSH, it was a different conversation than the one I had with Carl, because NIOSH was like, what are you talking about? I have no idea what you're talking about. And I emailed several different people and I'm like, okay, this is worrisome. And then when I talked to Carl, Carl was like, his email was much more positive. And he's like, in fact, he said, I want our MLAC management and labor representatives to know that we are part of a bigger issue in getting this straightened out. And we thank you for your due diligence on this important matter. Anyway, we know that he knows this is important. We know it's important. And NIOSH has the data. We're just waiting for this report. But the people I reached out to at NIOSH, the supposed firefighter people, their emails were like, we have no idea what you're talking about. So that was of concern to me. So anyway.
I'm gonna suppose just a little bit since it's
Okay, thank you,
slightly
Sarah.
in my wheelhouse.
Give me some
I don't think that the
information.
registry is well known.
Okay.
It's not a mandatory thing for firefighters to fill out. I was looking for some of the information last night because I was like, oh, I feel like I should know more about this. Same thing, dead ends with where to find things. I'm not sure when that registry was created. I believe it's fairly new within the last few years. And so I know they're looking kind of short-term and long-term studies with, I think they need more reporters.
Okay.
Though, and I don't know if that's a lack of education to fire departments, both professional and volunteer, or quite what, but
Okay.
I think it's a little bit like molasses in January for some of that information right now.
Okay. So,
And that was kind of my understanding and poking around, looking at the obligations that we kind of agreed to when we made the recommendation on the bill, I guess at the time, is that the understanding is that this system was being created and that there were studies that would be generated, as you said, short-term and long-term. And so I think as discussed amongst the co-chairs, we absolutely think that we did commit to reviewing whatever they have as soon as they have it. You know, as you mentioned, that's a priority. But if they don't have anything yet, then there's nothing to review right now. But we will continue to look, and as soon as they have something, and obviously Carl's been notified, you know, Sarah, as you said, in your wheelhouse as well, and then have made connections with NIOSH folks that we'll make sure we get that as soon as we can and review it.
so that's the update. Okay. Let's see.
Good morning. Barbara Anderson, I'm Budget for Oregon Workers. It's a pretty short update. I know we've discussed creating some worker-friendly videos on our website to talk about just some of the very basic things, how to complete an 801, what happens when there's an aggravation or a worsening, how to change attending positions, what happens if I don't agree with the closures or the denial. Right now we have one that is basically complete. It's in the final review. I did the voiceover recording last week, and that's for the how to complete an 801. So hopefully that'll be out there soon. And once that's complete, it'll be done in Spanish. So then we'll just keep going down the line on what videos we want to create. I have been talking with some other worker advocates to see what kind of videos they'd like to see, what things that they hear the most about. So we're working with them on that. But we are also making some additional changes to our website. We've received a lot of feedback from worker advocates and workers about how sterile our website seems to be and how uninviting for injured workers. So we're working on that as well, on how to make that a little more welcoming and introduce ourselves and I guess make it feel a little more human for workers. And the other additional thing is that we, as we kind of find our footing in regards to where we fit in with, like, as far as OSHA safety and health, we'd like to add some more information on that as well, because we do, you know, nobody really knows that we participate in that much. And right now, like I said, we're still finding our footing on how we fit into that program. But we have had a few meetings now with worker advocates and unions and stuff to discuss kind of how we can help. So the only other thing we did is that, you know, we did finally add to our website how workers can participate in rulemaking. So that had not been on our website before, and we did receive some questions from workers about how they can engage in that. So that is my update.
May we get a link to the video when it's
Oh yeah, I'll definitely send it out. It'll be my lovely voice. Nobody else wanted to do it, so.
I love it.
Great.
Thank you.
Okay.
So I see, yeah, work plan, review and update. Next.
Yes. So I sent out the latest work plan, and we have moved through a lot of the tasks and topics on our work plan. So I was hoping that maybe with the time that we have left in the meeting, that we could brainstorm some new ideas of stuff that we'd like to work on moving forward.
Yeah, I just want to comment that the NIOSH bullet
Mhm.
that's on the work plan seems appropriate, okay, based on that
Okay.
last discussion.
Okay.
It's just kind of open-ended. I mean, I was in the meeting when we decided to put that on our work plan and in that letter,
Mhm.
and I think it was just, I don't, it sounds like a time frame was put on it, but I don't think we knew of one.
Okay.
So I
Great.
think just being open-ended.
Okay.
It was more to me that was as part of discussion of a bill for presumption
Mhm.
and the lack of information to support the presumption was a sticking point. And so this was information to come,
Okay.
and that it was, you know, so we were prepared
Okay.
if some other presumption bill came forward.
think that's the nature of it.
Or hopefully no other presumption would come forward until we had data, I think, as a stronger stance.
We did say that, but I don't know
The
what power we have to do that. Yeah, we hope, yeah.
And the unfortunate thing is with the lack of data for firefighters, they typically studied one subset. And so there really isn't studies on women, people of color in the firefighting world. And I know they're trying to attempt that with the cancer registry, but until there's some stronger teeth or more outreach from them to hit more firefighters, I think you're going to continue to see some lack of data for subsets of the firefighter population.
It seems like such a big issue across the country. Is there anything that we can do as MLAC or Oregon to advance that, or to advertise that something that people should submit on the registry? Or
I'll be honest, just for thinking of my own department, we haven't had any education. There's been no push other than for a few folks we've had some fairly common instances of young folks with cancer from the job. And I think it's a little bit incumbent on the folks running the registry to really push education, and then for the leaders, both the Oregon State Firefighters Council and our own individual departments, to really start pushing that education. I know that's something I can probably do on my end in my little own world here, but
Is that,
it's important.
yeah, and if that's something kind of relevant to, you need the data set to do the study, is that something that we could also add to sort of support this work? And I don't know if there's somebody from the registry that could even virtually give a presentation on it, and then have, as you mentioned, somebody from labor, somebody from management kind of present on that as well and say, this is why this is important. And I don't know if there's an agency that's adopted it well and could kind of give a.
There's only, it looks like three, they have what's called, my late night readings last night, there's only 3 gold star departments is what they call, where I believe it's over 70% of the department is registered. That's in the whole country. And so that tells you there's some sort of lack of communication. And I think now that we know, at least on Oregon's part, between the president of the Oregon State Firefighters Council and each of the individual unions, at least from a standpoint of professional firefighters, that should really be pushed to get that information in there so we have the data to support. Especially as chemicals, heavy metals, and all the fun things that are coming with lithium ion, the unknowns. The more data we have early, the better for everybody.
Yeah, so perhaps we can brainstorm, because I always think of, when you have a department that's done really well, or agency, company, whatever, that is doing something really well, if they can kind of come and present on lessons learned from their adoption, that's really helpful to have that discussion, because a lot of times there may be everything that you want to replicate about what they did, or maybe it at least gives you a jumping off point to say, that really worked in their situation, but these 4 things are different for us, so we would do it this way instead. But at least you have that kind of starting point.
Sounds like a good project for me.
Yeah.
To reach out to both the registry and those gold helmet departments and see what we could potentially do to participation across Oregon.
Yeah, and anything we can do to facilitate that, I think, would be helpful.
And Sarah, I have the contacts of the people I contacted. I was just looking through at NIOSH. And this person's name was the team lead for fatality investigations.
Okay.
Yeah, I'm happy to.
Yeah, I'll grab some of that information from you.
Okay.
And then I'll make contacts with the state and probably the registry. Get hold of somebody there and do that.
Yeah, that'd be great. So that's, I guess, on the back of the page. Patrick, I believe you're talking about number 4 on the ongoing updates.
Yeah, that's the update, but I guess it would be a new topic, a new work plan item to somehow advocate for people to help the report come to be, I don't really know how, so it sounds like firefighting departments, then everyone that works there would submit and give their cancer history?
Yeah, they want you, from what I was reading last night, they want you to, the the cancer registries for in the state, like anytime a reportable cancer, it doesn't necessarily flag that it's a firefighter. And so that doesn't necessarily go to their registry for an overall national database. And so by getting your name and health information in there, but they also keep track of how many fires you're going to. I'm not sure if it's like what kind of fires, whether you're going to a chemical plant versus house fire. I have my own little research to get started to, I need to get myself in there, as it turns out. But they want to collect the information, and I believe they're doing both short range studies and long range studies, following people through their career to see what the common cancers are that are popping up, and what fires or types of chemicals that may be associated with.
I'm being educated by it. I mean, I don't know. I'm not a firefighter, but.
As it turns out, one of the major things right now that's in our own gear are the PFAS, the forever chemicals,
Yeah.
finding out even the exposure wearing the gear that's supposed to protect us, the problems that it may be causing.
The exposure, what was that?
That our gear that we wear into fires has chemicals in it that are problematic. So more to follow. I'm sure.
Well, Sarah, maybe you and I can get together and just talk and
Yeah.
share information. I'm happy to do that.
So and then maybe kind of pending the discussions, and we can see how we want to move forward on number 4. If we want to kind of take a more active role in helping support.
Yeah, support the advancement of the information.
Yeah.
Now, as you're talking, it's like the discussion was, is the prevalence of cancer more higher among firefighters or not? And that was the thing that we
On
didn't
what?
really know.
What type?
And what types?
Yeah.
And, there wasn't really,
There's
it's
definitely
assumed, but not known.
Well, there's definitely with the first presumption there is very clear data for a lot of cancers. There's not as clear data for female firefighters and female reproductive stuff because there's no studies and there's no database. So some of it is, we know carcinogens do cause this, and so inequity and when putting 2 and 2 together, it's likely to cause some of the same issues. So they do have data for some and a good portion of cancers, but not all. And as, like I said, when, we're starting to get into with the electric car fires, we don't know yet what the heavy metal exposure to heavy metal smoke. We're learning very rapidly there are issues with it. What are the long-term things? We don't know yet. But it's a little scary. So, it's ever evolving.
Scott, I wonder, would this, be deemed as appropriate subcommittee work, having representation? And I don't know how far we want to go down that path. I think the data is super important, and I appreciate your willingness to take the lead, Sarah. And I'm wondering if a subcommittee and representation from both sides might have a balanced approach to it.
Yeah, I think that would be appropriate. And I think a good model as well moving forward if there's other issues that come up that we want to have kind of more data-driven subcommittees and outreach and stuff like that, that'd be completely appropriate and a really good use of our resources. So I don't know if you want to kind of get with Terry and talk and maybe figure out some of the basics of the moving parts, and then we can talk
Report
about,
back.
a subcommittee on who would be involved and how to move forward on that.
Absolutely.
Thank you, Sarah.
If we're just, open dialoguing, on the educational sessions, so 2 and 3 seem to really tie into some of our other open items, like the insurer's perspective from start to finish and the injured worker's perspective from start to finish. And if we had those perspectives or multiple of them, maybe it would highlight common themes that were issues throughout, such as access, such as intimidation, retaliation, and then maybe we would have a better pinpoint or a better focus.
And it's so funny that you brought that up, Sarah, because I talked to the co-chairs about having those panels in November and December. So insurer perspective in November and injured workers perspective in December. So we did talk about that, didn't we? Yeah, I thought we had. Putting together a panel presentation for the last 2 months of the year.
I think hopefully that would, highlight some of the, the areas where, our other bullet points could focus our attention.
Well, and I don't know when we're doing depending on how the panel's set up, there could be a possibility to kind of identify some of the work plan topics and, they can give their presentation and then sort of speak to a couple of these issues, if anything makes sense, that really sort of focuses in on an issue for them. I think that would be positive, because I think the hope of the DEI and everything else is the idea of, looking at an issue through different perspectives, different lenses, and understanding it from all the different angles. And so I think that would be very helpful to have, the panel presentation to sort of say, these are the issues, or this is our take on all of these issues that we know that you're working on. That would be helpful.
So we're good for doing that, the insurer panel in November and the injured workers perspective in December. I will start working on that if we're good with that.
I wonder if those would be better in person, if we could commit to additional in person. I think you have better dialogue in person, you have better communication, those eye-to-eye conversations are more impactful.
It works for, I'm always here, so it always works for me. I don't have a problem with it.
Just run it out there for the committee to consider.
I think it's a really great idea. Maybe we could take a look at, convenient locations too.
Yeah,
absolutely.
Can I go back just to the registry for just a second to ask a question? Does Oregon OSHA play a role in this registry at all? Are they doing anything? Sarah, do you know?
No. What I was looking at was a national registry, and I can't remember, it was on NIOSH's website, but it seemed to be a separate entity, so I don't think that, that's my knowledge, that.
Yeah, I'm not aware of OSHA having a role in the registry.
It could be a place to reach out for additional information.
and it's been a long while since I did work with federal agencies, but NIOSH is its own independent, or is it housed under OSHA in
It's
some
under
way?
CDC.
Under CDC, that's
Yeah.
right, okay. So, yeah.
That answers a big question. I didn't know that.
I remember we're a state OSHA program as well, so.
That's what I was wondering, is if there was any crossover there, yeah, so.
What was the state, Michael?
So we're one of the 20-something states that has its own OSHA program. So federal OSHA, isn't really that relevant.
Yep. So do we want to maybe work through the shorter work plan first and just check things off, and then work through the bigger list of topics?
They're kind of the same. I mean, I put some things on. Anyway, you decide.
Well, does that give you focus?
Pardon?
Does that give you focus if those are items we're addressing, or are you looking for additional items?
As I looked at them, I was like, so like the legislative session preparation, that's almost gone.
Yeah.
So check that off. But I'm like, next year's gonna, and we do have a full legislative session, so we need to keep that in mind. But that will be over too. And so I was trying to think about things that we should be thinking about after that.
Well, we have this meeting covered with DEI. Next meeting is the mental health.
Yes.
And then, so do we have anything for September?
September is just going to be a normal hybrid meeting. And then October is our off-site meeting.
And then November and December
will be,
and then you're going to have session.
and then it'll be session. And in between, I'm suspecting that people will start coming in and talking about legislative concepts. So we'll be busy. But I just wondered if there was anything, anything burning that people wanted to get on the work plan.
Terry, do we have a time for the October meeting?
It's going to be 10 to 12.
Okay.
So not a burning issue, but an offer for an educational topic if the committee's interested. So you all are very aware that each year we set the premium assessment and the WPF assessment, and we come in and kind of tell you what it is. There's a lot that goes into our review, analysis, and determination of what those two rates are. And if you'd be interested, I'd be happy to give you that kind of behind the scenes look at how our economists are involved in looking at, future scenarios. And we do a lot of scenario analysis, et cetera, et cetera. So there's a lot that goes into it. If you're interested and have time to fill, be happy to come in and, Matt and I, our economists, or, whoever, we could put together a nice presentation to explain in like a lot of detail how we develop those two numbers.
I'd be interested. I love modeling. So yeah.
September.
September.
Yeah.
Is September a good time?
When do we finalize the rates?
Right around
September.
September.
We could follow up with Tara. The only thing I want to be careful of, we're very open and transparent and happy to explain everything that goes into it. But if that meeting is like right before we finalize it, it could be a little awkward. Or it may put another way, it could be more beneficial to wait until right after we finalized it, and then we can even say, here's exactly what we talked about, what we analyzed, the scenarios we did, et cetera. So as long as we're done, it might be a little bit better of a discussion.
That makes sense to me. Of when you have the result, you can then track the entire process.
We can chat with Terry about the timing. But
What was our October meeting for again?
That's the offsite one in the Dallas.
Oh, okay, yeah.
Yeah.
Yeah, I was gonna say maybe we could switch the two.
No way.
No way.
Sorry.
No, that's okay. Yeah, right.
Yeah, throw something at you.
Yeah. Absolutely.
Yeah. We can figure it out. I
Yeah.
think that's a great idea.
Yeah, it'd be very beneficial.
Yeah.
I've had many people ask me, where does this number come from? It's the magic.
It's like the lottery.
Yeah,
No,
right.
just kidding. It's not. It takes a lot of hard work.
Absolutely.
Yeah.
I think that would be great. And I don't know at some point, probably further on, if there would be, if folks would see value in some kind of compliance / jurisdiction overview of how that whole process works and where the checks and balances are on things, because I know a lot of it is from an injured worker's perspective, there's sort of the employer, the insurer, WCD, other agencies involved, and there's not kind of a clear picture of, okay, this is what OSHA does, okay, this is what WCD does, okay, this is what the insurer does, and then here, the employer's role and sort of the checks and balances, and I know a lot of times dealing with the ombuds office, what can they facilitate with? Can they help with this? Can they help with that? Where sort of what are your support structures that you have as you try and navigate all of this? I think that might be helpful.
is that like the regulator's perspective, start to finish?
There you go.
Regulatory
Yes.
tour.
Yeah.
Yeah, I think that would be, So I don't know if that sounds like something that would be helpful for folks as well.
September. Just kidding.
Just kind of building on Sarah's comment about the trainings for November and December kind of tying into the work plan. The open-ended time loss was such a big discussion in a subcommittee before, and it's like, just says examination of issues here on our work plan. I don't know, like maybe looking at it, like having an injured worker, like in your panelists, talk about what open-ended time loss meant to them, and then insurers as well.
Mhm.
Like if it was part of the trainings, or like you gave them that as a topic of something that we're interested about,
Mhm.
that it might inform further evaluation of it, so that we can flesh that out a little bit more.
Okay.
Well, that's kind of what I was thinking, is depending on how the panel discussion is structured, if you have folks just giving tons of examples of, this is my experience, this is my understanding of things, this is how I view it. But then if there are some kind of more probing questions, present, I don't know if it's going to be a panel that's moderated and people present, and then there's a few kind of questions that are asked, and then the committee can generally ask some questions. But yeah, if they could be provided something like this beforehand so that they can give their sort of give their perspective and then be able to tie. So looking at that, my perspective, my experiences, these are my readings on these issues, or this is kind of, these are the things that are prioritized in my mind or should be, and why, that you could do something like that.
Because there could be many things they talk about.
Yeah.
So just giving them a list of things maybe that are of interest. I think under the legislative session preparation, didn't we finish the two open things? The video's done, I think.
Yeah, and we did the survey at the end. Yep.
I have them all crossed out on that.
Yeah.
Oh, I have a piece of paper.
And evaluating for
You see another
effectiveness,
Oh, there's another one.
have we had any feedback from folks from stakeholders or others saying?
I think 2 stakeholders returned the survey back.
Any,
And I think I gave that back to the committee, was it in the last meeting or the meeting before last? Yeah.
Mhm.
Yeah, so that feedback was in all the
Perfect.
information that we gave back. Yeah.
but in terms of the video itself too, have we had any feedback on that from stakeholders? Positive, no.
Haven't heard anything, no.
I'm going to assume that means it's working well.
Yeah.
I think that this session might tell.
Yes.
Let's see. And I just want to ask this question. Everybody's Workday account seems to be working well while I'm looking at that.
I love Workday.
Oh, yay! I'm so glad to hear that.
That was a little sarcastic. It's so cumbersome and so unintuitive.
Yeah.
I'm sure I use it every day.
Yeah.
And nothing's in the same place twice.
Go back to work.
Aren't you glad you asked?
Okay. All right, let's see. Okay. Okay, we have our trainings for the rest of the year. We'll look at September.
So Terry, just to recap that you're going to add the regulator's perspective or regulator tour
Mhm.
to our work plan, and then more exploratory on the NIOSH
Yes.
and a potential subcommittee coming from that
Mhm.
after working with Sarah. So,
Yes. Seems like there's something else. Thank you for everybody's hard work on this work plan. You guys are doing a great job. I did just want to cover this real quick. Because
Sure.
we did send it out. And this is for the August training, the mental health claims. And I just wanted to make sure if there was any questions about it. I think it's pretty straightforward. on the mental health claims, and the claims are accepted disabling claims. But this is the information that you had requested for the training that we have in August. So I just wanted you to have it ahead of time, and if there were any questions, we talked about it now before we entered the training in August. So,
I guess maybe a percentage compared to other or non-mental health claims. Is that, I didn't read it yet because it was.
oh, okay. So what you have is first responders, and the orange is all other occupations. It says all non-first responders, but what it is all other occupations.
Right, that's for mental health, but in comparison, how many mental health claims do we have versus a percentage of mental health claims in the overall system?
Say that again.
A percentage of all claims being mental health.
Oh, versus like back injuries or
Yeah.
Oh,
versus cancer
okay.
or other things.
All right. We did not ask that, I don't think. Okay.
That would be helpful, just to know the scope of,
Okay.
I see the rise,
Okay.
so I can get the trend line, but just in general.
Of all, I gotcha. Okay.
It'd be interesting to also know the trend line of all claims as well, what we've seen at the same time period.
Is this complete? Because that's an account 171 for 2022. Does that mean that's all mental health claims, 171? I mean, I would think there's thousands of
Yeah.
non-mental health claims.
This is just mental health claims, accepted disabling claims for mental health. That's it. That is not
It's a small
any other
scope is
claims.
what.
Yeah,
Very small. I mean, if that's
Yeah, that's
complete,
what-
171.
this is just mental health. We're just looking at the mental health data
That's why I think the percentage would show it clearly.
of all claims. Okay, I can do that.
Have there been any, I'm thinking like regulatory or legislative changes, whether it's a presumption or an acceptance or a change in a definition during that specific time period?
Well, it has Senate Bill 507.
Mhm.
So in 2019, on September 29th, that is when the bill went into effect. And so claims were changed during that time. So if you look on 2019, first respond, oh, I'm sorry.
Yeah, sorry, I saw that, and so I know it's compensable filed after the 29th. So
Yeah.
it was passed in 2019 and it was effective by the 29th? Okay.
Yeah.
Because that's the other question I had was, was there anything before or after that time period or additional rulemaking potentially where and this is, I'm asking this out of ignorance to try and educate myself on it. When 507 gets passed, I assume there's some kind of rulemaking. Perhaps that was concluded by this September 29th date. Have those rules been in effect, unmodified throughout that time? Or do we know?
I have to phone a friend.
Okay.
Just a second. Was it rulemaking?
I don't know, because it's not my rules.
Oh, okay. Sorry. I have to phone another friend
Okay.
and I'll have to get back to you.
No, yeah, I
Okay.
don't need an answer now. I'm just,
Okay.
the things that I'm thinking about is in terms of analyzing the data. And when I got this, I see, a little bit of a spike in 2021. Is that just because people were savvy to mental health issues post-COVID and were filing that and getting help? Or was it the impact of you can go through COVID and the lockdown for a certain period of time and then the mental health claims really start going up because of the difficulties?
Yeah.
Or was there a rule change where there was a rule initially rolled out this way and then there was a modification at some period? And also, I don't know if there were any other additional tweaks or things that changed.
Okay.
Is kind of my thought process in going through it. Is there anything else to help explain the data and the trends?
So I know that we looked at the data before that date and we looked at the data after that date and then just kind of combined them because it wasn't like a steep, huge curve.
Gotcha.
So, but I will look and see about the rule change because I am not sure about that.
And also ignorant on my part. What about when mental health parity came into play? What year?
And that's for medical benefits. I don't know if that's.
No, I
that relates
understand,
to-
but I'm wondering if there's a correlation there too. This understanding that mental health is on the same field as normal health claims that, I'm just wondering if that could something be.
Well, I think, yeah, culturally, when people link that as a healthcare issue,
Yeah.
right, that then could be a workers' comp issue at the same time.
And Scott, to your question too, there might have been significant court cases that were, incorporated into the statute because those are, the interpretations are read into the statute. So we might keep an eye open for that.
Right. Well, that's what I'm seeing looking at the first responder line, there sort of seems to be a plateau from 2020 to 2021 and then an uptick, which I'm going to guess was the nightmare that was COVID and dealing with everything relating to that. But again, curious, is there a court case? Is there a board decision? Is there a rule change? Is there something else that
It's making it.
that may influence that one way or another?
I think one thing to look at too is, I know for at least the first responder level, it wasn't accepted PERS. While it was an accepted workers' comp, PERS didn't necessarily accept the mental health disability. That's, I believe, a rule that's in the works, either has been changed or is in the works of getting changed, but that may have, where we may see some numbers change even upcoming.
Exactly. That kind of like, what else would influence that?
Okay.
Another piece that might help drive future plan activity is if we have maybe the top 5 or top 10 categories of claims for the past 5 years or what have you. While you're digging into some of this data, it might be helpful. Again, I think looking at total claims and percentage-wise to compare to mental health. But then if we can just give some general categories for what we're seeing and trending, that might be helpful too, and can inform future focus possibly.
Okay.
Yeah, I think that would be helpful. So if you see something start to trend, is there anything we can do to?
Injuries or what are we seeing?
And do we have, with Sophie looking at 171, is, one is far too many, but at the same time, relatively small compared to the total number of all claims. Do we have any kind of more granular information? I see there's a breakdown of the first responder categories. I know when we were analyzing things in COVID, we had sort of a breakdown, and I know a lot of times there'd be a spike in data, but it was sort of one location that you'd see this huge outbreak. I would be curious, especially for the non-first responders, that 112, do we have any kind of better breakdown? Is it a specific industry, or is it 2 or 3 job sites each had 10 because there was a horrific incident at the job site?
In the years that we're looking at, bus drivers, truck drivers, and registered nurses come up highest in mental health claims. And the rest are first responders. Because that surprised me too.
Interesting.
Yeah.
I'm sorry, Terry, can you repeat those?
Bus drivers, registered nurses, and truck drivers, heavy tractor trailer come up highest, along with the first responders.
Thank you.
Can we use this data to drive some of our training to more understanding? And I know, they're probably not experts in any of that, but
Yeah. Well, yeah, we can have it available.
topics that maybe we can talk about during
Trends, yeah. And subway and streetcar. Retail salespeople too.
Can we share this with the trainers? So,
Yeah.
I mean, I don't want them to come in cold to information we have.
Yeah. I meet with them in a couple weeks, I think. Yeah. We'll talk about it. But I'll also look at all occupations as well. and all claims, accepted disabling claims.
What I don't know too, thinking of a construction setting, a lot of times where there's a horrific accident or issue on a construction site, you'll then have kind of a impact to the entire site. So you maybe even have multiple employers, but it's a single location. So I don't know, especially the drivers, it seems interesting to me. And I don't know if there'd be any way to break it down. Is there kind of a single hub or location or something with that? Or there tends to be a lot more in rural areas than not, or if there's any kind of other way that we can break the data down.
So the data comes in on the 801, so it's how they report it is how we get it.
Gotcha.
So addresses are on there. So we would at least be able to, the site addresses where they were injured is on the 801.
If
So
the
you'd at least be
801
able
is filled out properly.
Yes,
There's always that.
Theoretically, you should be
Yeah.
able to get some addresses or even cities. I mean, just knowing the city.
Because I wonder,
Well, but it has to be non-identifiable because we have to keep it confidential.
Sure, and,
Yeah.
and I mean more for
Yeah.
you to dive into the detail on that,
Yeah.
whatever.
Yeah.
Terry, I'd be curious, I know this is count, which isn't super interesting, but in terms of dollars as well, I work with PTSD claims a little bit and we serve them. And those are quite large, each one, although there's a small number, each one is quite expensive. So I mean, I would be curious to see how the dollar change is as well as just count. If that's available.
Okay, I'll ask.
Severity.
How's
By
that?
incurred, yeah. I don't know.
I don't know if I can or not, but I'll certainly ask.
Aren't you glad you asked this question?
I'll
I
always
guess I'll throw
ask.
one more question out there. Is there data for the amount of like claims of those who were able to return to work versus those who weren't?
Good question.
Or what about even time frame that they were, assuming that they were released to work, what was their time loss period or at least modified work, whatever limitations were set, how long was that duration?
And to touch on the kind of getting back to work, and I suppose also the timeline, were there any kind of worker retraining funds or
Yeah,
access to those programs? I know we get reports on that.
Okay. Okay, I think I got everybody's questions, so I
And-
can follow.
Not to add too much more.
Keep going, Scott.
We'll have a whole work plan just on this thing. But is there any if there's a comparison either to Washington, data from Washington or California or the highest and lowest states in the US or something like that, if there's a sort of other,
Has a like presumption.
so another jurisdiction that has similar presumptions, or maybe there's a state that leads the way in terms of having either a high percentage of total claims are mental health related, or some kind of other
How we compare?
way that we can look at the data and analyze it.
Gotcha. Okay.
Anything else work plan related?
This is all great information.
Thank you in advance, Terry.
Thank you.
Yeah, Terry, thank you.
Happy to help.
So the next thing that I see on the agenda formally is upcoming meetings.
So on the flag again, I will be remote on August 1st.
Yes, and
Yeah, and
Margaret as well. Yes. Lauren, will you be able to make it to the August meeting? I think you said you'd be remote as well, right?
I think so, yeah.
Okay. And they did agree to provide a hybrid training for people that couldn't attend.
Oh, great.
Yeah.
That would be great. I had this, like, there was a date that I had.
I just want to say lunch will be here at 11:45. So, and we kind of need to move the room around a little bit before you conclude. Okay,
Sure.
so.
All right, anything else? Other questions? Yes. There's still a bunch of fruit left over there, so help yourselves. With that, I think we can adjourn. Great.
Thank you.
Thank you.
Thank you.
I'm gonna eat lunch in a little bit. I'm kind of, you good?